And we have to, now not all women can take estrogen, not all women want to take estrogen, but even if you don't choose to take hormones, you should understand what menopause is doing to your body so that you can try to counteract those negative changes as best as possible with whatever method you choose to use.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this. What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and I'm back this week with another amazing Suburban Warrior here to share her expertise with you today. Before I introduce my awesome guest, first, I wanted to remind you that we have the free download of the From Pause to Power Suburban Warrior Roadmap. And this roadmap is free to you, and it's basically everything you want to know during perimenopause and menopause to help you through. It's everything I wanted to know back in the day when I didn't have it. It's a free download that it can be your guide as you go on this journey. So I encourage you all to check that out. And while you're at suburbanwarriorpodcast.com, please feel free to sign up for our Pause Like a Warrior newsletter, because that is something that drops in your inbox weekly. And it really is just a summary of the amazing guests that we have on the podcast each week, as well as the latest news for women in midlife for health and wellness. So be sure to check that out at suburbanwarriorpodcast.com. And now let me introduce to you this week's amazing guest. It is Dr. Amy Killen. She is an ER doctor turned entrepreneur, and she began exploring the world of healthy aging and longevity medicine after struggling with stress and burnout in her own life. One day, she looked around her ER and realized that many of her patients were getting sicker instead of healthier over time, struggling with chronic medical conditions that could have been entirely avoided. She quickly discovered that we have more control over our health, both short and long term, than we might think. She has made it her mission to show the world what healthy aging can look like. Dr. Amy provides cutting-edge regenerative medical treatments. She is a leading longevity and regenerative physician who speaks internationally about the benefits of PRP, stem cells, body-identical hormones, and good old-fashioned healthy lifestyle for optimizing skin and sexual health. She created Hotbox to provide easy access to the best longevity-promoting ingredients on the market based on both her work and the constantly evolving research in this field. Welcome to the podcast, Dr. Amy.
Thank you so much. I'm excited to be here.
Me too. I am thrilled to have you on here. I follow you on all your social platforms. I think that you deliver really such amazing advice to women in midlife. I think you're doing some really innovative, cool things to help us during this health and wellness journey at this time when it is really confusing. And I think there's a lot of voices out there that are talking about all of the shoulds, what we should be doing. But I love what you say about, really helping to educate women to know that they have the power and the control is really within them. And then there's just all these amazing resources to us to follow what might be right for us. So why don't you start out, by telling us a little bit about your journey from ER into longevity medicine?
Yeah, so I was an ER doctor for 10 years. I'm board certified in emergency medicine, and I worked in a busy emergency department in Austin, Texas, mostly. And it was super fun. I had a great time. I loved, occasionally saving lives and then all the other things that ER doctors do. But towards the end of that, I have 3 kids, and I had 3 kids within 2 years. So I had twins and then another one 20 months later. And when my third child was a week old, my husband moved out of the state for a job. So I had 3 kids under 2, and I was the kind of lone caregiver. And I had to be at work at 4 a.m. for my job. So I'm getting up at 3 a.m, going to work, just like sleep deprived, like you can imagine. Stressed, not eating well, not sleeping, all the things. And I did this for a while. And I just really, one day I was in the ER, and I looked out at the waiting room of people that were kind of waiting to be seen. And I realized that if I didn't make some pretty serious changes in my life, that I was going to be one of those people in 5 years or 10 years with something that was probably preventable, if we had gotten to it sooner, and that I had to make some big changes in my life so that I didn't become, one of those people. So I eventually left the ER in 2013. I started learning about bioidentical hormones. That was kind of before they were cool back in the day, about how to treat men and women with hormones. And then also just everything else, like how do we, lifestyle changes, how do we prevent illnesses? What are some tools that we can use, combining tools with traditional allopathic medicine, integrative medicine, kind of putting it all together. And then on top of that, I started learning about some of these regenerative medicine strategies where we use kind of get your own body to heal itself using things like PRP or stem cells or shockwave therapy or some of these other modalities. So that's kind of me.
Yeah. Well, I love that. And I think, just in that story and hearing your perspective of looking out into the waiting room and having that sort of light bulb moment for you and realizing that, wow, I have to make a change, but then actually doing it, because after, that's a big step. Like after all of those years of becoming a physician and training to be in emergency medicine and then being in it, I think it takes a lot of confidence, and it's a big step to be able to kind of make that shift in your career. So that's amazing that you were able to do that. And into regenerative medicine, which probably isn't a field that was like top of mind for you when you were like in medical school or going through your training, right? It's like not
Well,
something that
regenerative medicine wasn't even. I guess PRP was around. That's platelet-rich plasma, which is you get that just from your own blood. That's been around for 30 or 40 years. That was around, but I'd never heard of it when I was in the ER. And then stem cell procedures. Those were the only thing I knew of were the ones being used in the hospital, like bone marrow procedures to treat children who had lymphoma and things like that. Like we didn't use stem cells for other purposes. I had no idea they could be used. So that was really, really early days for stem cell procedures, but certainly as an ER doctor, honestly, I was just thinking today, I didn't even really know what I'd never heard of perimenopause. I didn't know about any of the, I had never heard of like estradiol and estrone and estriol, like the hormones in menopause.
Right.
I didn't know anything about menopause except that you couldn't get pregnant anymore. And therefore, I didn't have to do a pregnancy test on you.
Yeah.
That's it.
Right.
That was
Right.
all I
Exactly.
knew.
Isn't that amazing? That is really, really crazy. But yeah, really, even, as a nurse and, I was an OR nurse specifically, but like knowing your body, like the only thing you knew is that menopause meant your period stopped.
Yep.
That's it.
That's it.
And the story, you can't have kids anymore. So, and now we know, wow, there is so much more to it. So let's talk a little bit about regenerative medicine, because I think I find it fascinating. For me, I feel like I've heard about it more and more, maybe because I'm just getting older, but there's so much there's so much that we can do in regenerative and longevity medicine. And so let's talk about some of these sort of procedures and things that are available. Like you mentioned PRP, you mentioned stem cell, like specifically for women in midlife, because that's really who's listening to this podcast. Let's talk about PRP, because even though it's been around, I feel like I've only heard about it maybe in the last 5 years or so. I've heard about it for like helping with hair regrowth, physicians using it for that, maybe some skincare regimens, going into whether it's dermatologist or something. But tell us how you're using PRP.
So I use some PRP. At this point, I use more of the little kind of stronger regenerative medicine, stem cells, things like that. But with all of these modalities, what we're trying to do is we're trying to get your stem cells and your cells that you already have in your body to act like more youthful versions of themselves. So that's all of these things. We're essentially communicating messages to your cells to say, hey, Like, stop being so lazy. Like, crank out a few more growth factors. We need more collagen. We need better blood flow. We need less inflammation. Like, so that's kind of the goal with all of these, whether it's PRP, which comes from your own blood, and it's just the platelets concentrated in your blood, or something like stem cell procedures, which can come from either your own fat or your own bone marrow, or we also can use like donated placental tissues and things like that. But all of these, they're just communicating signals to your body to act more youthful. So with that in mind, we can kind of put them in a lot of different places and they can act in a positive way. So for instance, for women, we can use them for hair to improve hair growth. So increase the number of hair follicles, as well as the thickness and quality of hair follicles. I can do scalp injections, which I do frequently. We can use them for skin, either injecting or like microneedling them into the skin. We also can use these IV, just put them in your IV, and the stem cells actually kind of they go to areas of inflammation or areas that potentially need them. We can put them in your joints, your neck, your back. If you're having like rotator cuff injury or your knee is hurting, depending on what's causing it, these are not going to fix everything, but they can be beneficial for a lot of things. And then I also do injections into the sexual organs as well. I do it for both men and women, injecting into the penis and injecting into the clitoris and vagina in women to try to improve blood flow and sensation and tissue health in those areas.
Yeah, that's amazing. And so are the stem cells I know PRP comes right out of your blood. The stem cells, is that also coming from the same person?
Yeah, we can. There's two different ways to do stem cells. You can do stem cells from your own body, where we either get a little bit of bone marrow, or we get a little bit of fat, like a little baby liposuction from like your hips or your kind of like love handle area. We can get stem cells from that, or we also have the ability to use placental stem cells it's from donated placentas, from C-section deliveries. Instead of throwing them away, they donate them to the lab and we screen them. They screen them and do a lot of tests on them. We can also use those types of tissue.
I see. Okay. And are these are obviously outpatient procedures?
Yes.
And are they painful?
No, I mean, we don't want them to be painful. We will use anesthesia, either numbing cream or injected anesthesia, or in some cases, my partner and I here in Park City, Utah, we do something called the full body stem cell makeover, where we essentially put you to sleep with an anesthesiologist. So you're moderate sedation, you're still breathing, but you're not awake. And then we do kind of head to toe stem cell injections, scalp, face, sexual organs, all down the neck and back, all the joints, into the into the veins. And so we do the whole thing in about an hour and a half. But you're asleep for it, so when you wake up, it's not that big of a deal.
That's amazing. And then so take me through sort of like, what is that like afterwards? How long does it take to sort of see, feel, notice a difference?
Usually with most regenerative procedures, we are looking at 2 or 3 months before you're really going to see benefit, because you really are getting your own body to kind of get jump started. And so you're getting your own body so it can take some time. Some people will see some benefits in just a couple of weeks, because these procedures and treatments are very anti-inflammatory. So, if inflammation is a big cause of whatever your problem is, so, if your knee pain, if a lot of it's from inflammation, then you may see improvement right away, but the actual kind of building up of healthy tissue will take a little bit more time.
Okay. And then how often are these procedures recommended? Is it something you do once every couple of months? How often would you need to do something if you get like a whole body stem cell?
I mean, for the full body stem cell makeover, we're not usually doing it more than every few years, because it's a pretty big treatment. But for other types of injections, like if you're doing PRP injections, for instance, which is going to be a more affordable kind of entry level way to do this, then oftentimes we'll have you do 3 treatments at about 1 month intervals. So you'll do, you'll wait a month in between, like say you're doing your hair. You'll do your scalp injections, you wait a month, do it again, wait a month, do it again. And similar for face as well. So with PRP, we tend to like to do 2 or 3 treatments to see maximum benefits. With some of the other stem cell modalities, we may just do it once, or we may do it once a year. It just kind of depends on what's going on.
Okay. And so basically, so if someone gets one of these PRP or stem cell treatments, what are some other things that you might be prescribing for them? Are you also looking at bioidentical hormones, peptides at all, supplements? Like, let's sort of
Yes,
talk about.
all of the above, all of the above.
Yes,
So
yes, and yes.
yes. So in the clinic, we like to pair these procedures with other things that promote stem cell proliferation or stem cell activity. So for instance, we
Okay.
love low intensity shockwave therapy, which is using high
Oh,
intensity sound waves or pressure waves, and we apply it to the skin, and it essentially increases blood flow and stem cell recruitment. So we'll oftentimes do that before and then maybe after a series of those, like if you're doing for your joint pain or even sexual injections, we'll use shockwave therapy. Other
okay.
things like hyperbaric oxygen can be really helpful because we know that's great for stem cell proliferation. Red light therapy, like the red light therapy beds or the caps
Yeah.
for your scalp, those also activate stem cells. So those kind of things, those devices will pair with treatment when we can. And then we love peptides. We have a couple of different peptides. For instance, BPC-157 is really nice for helping to heal from musculoskeletal injuries, specifically. GHK copper is great for skin and hair
Yeah.
benefits. Some kind of growth hormone secretagogue or something that helps you increase growth hormone can be helpful for healing in general. Definitely, we love supplements as well. And
Yeah.
and then absolutely the healthy lifestyle part. In fact, I don't treat patients if they don't have a generally healthy lifestyle. If you are a smoker, if you have, really poorly controlled disease, or you're just not leading a healthy life, I'm not going to do a stem cell procedure on you because you have to have a healthy kind of fertile soil for these things to work. And I don't want you to waste your money, if it's not going to work.
Yeah. And okay, so I have so many questions. I have so many questions based on everything you just said, but I'm going to start by just sort of the healthy soil because I think it's important to touch on that. Like when you say a healthy soil, meaning like pretty much eating a relatively clean diet, sleep, like you said, like not being a smoker, things like that. Is that
Yeah.
what you would consider
Yeah, exactly.
like
And
sort
we
of,
want your
yeah,
blood sugar to be relatively controlled. Like if you are a diabetic and you have really uncontrolled blood sugar, that's not going to promote healthy
right,
healing. You're more likely to get infections or problems later on. Certainly you don't have to be perfect, and like none of us are
right,
perfect.
right,
But
right, right.
we want people. We don't want you to waste your money. We want you to have good results, and we know that in order for these to work, you have to have a healthy body because your cells are the ones that ultimately have to do the action. And
Yeah.
so, because we're actually, we're not giving you a drug and the drug does the work. We're giving you like a stimulus and then your
Yes.
body does the work. And that's what regenerative medicine's all about. It's getting your own body to do the work, but you have to also put in some work.
Yeah, no, I love that. And that's such a great point to point out is that it really is truly your body doing the work. We're
Yeah.
just kind of giving it that boost that it needs. So it has to be start from a healthy place. Okay, so the peptides that you mentioned, like BP-157, the GHK copper, growth hormone, are all of those peptides things that you would use for both men and women?
Yes, those are all
Yeah.
peptides that men and women can use, and I will say some of those peptides, depending on the day and the week, are
Yeah.
harder to get because the FDA is making some peptides the FDA has said that can't be compounded right now. Some
Right.
can, and this kind of keeps changing. So really, depending on when you look into it, but we always want to use peptides. Personally, we use peptides from compounding pharmacies only. We're not using research peptides or peptides that are
Right.
only meant for animals. I do think it's important to have a good quality source for your peptides
Of
because
course.
just like anything, if you don't have a good source, this could go wrong.
Yeah, absolutely. And you're injecting them, right? None of these are oral.
We actually do have an oral peptide that we use after our stem cell procedures called Rapid Rebound. I created that peptide. But
Ah, that's so
it's an
cool.
oral BPC-157 AOD-9604, which is like a growth hormone secretagogue, and then it has an anti-inflammatory called palmitoyl ethanolamide. It's kind of a mouthful, but anyway, that one's
Okay.
oral and it does survive the stomach acid. Most peptides, though, are either injected or sometimes we'll do intranasal peptides as well.
Okay. And do you think the oral peptides are like you said, maybe it's rapid rebound or BPC-157, are they just as effective as if they were injected or
I think that they're differently affected. Like for the
okay.
BPC, for one thing, we know that if you're looking for gut healing, taking it orally is the best way because you're getting right to
Oh,
the stomach and right to the gut. And there's a number of mostly animal studies, but good animal studies on that. So for BPC, you can take it orally or injected, but I think injected is a little bit stronger for like musculoskeletal healing. Oral is going to be stronger for gut healing.
Okay. Okay. Good to know. But just because I feel like there's a lot of information out there. There's a lot of promoting of peptides out there, but I am fascinated by the peptides because I do think that, at least in the people that I'm listening to that seem very knowledgeable about it, I'm learning so much. And I think that they can be a really great source of, to your point, sort of using your own cells, to help decrease inflammation, to help optimize the mitochondria and how our cells are working and all of those things without, getting into a danger zone, assuming that you're getting the peptides from people that you trust and from a good source and all of those things. So I think that's very interesting. Okay, let's talk a little bit about red light therapy. So I know there's blankets and there's the caps and you could put red light therapy really on any tissue, vaginal tissue. So what that really is doing is, correct me if I'm wrong, but that is bringing blood flow, correct, like to the area to help stimulate those cells and I guess I would assume decrease inflammation and help them just be healthier cells. Is that correct?
You can have increased blood flow, but the primary mechanism with red light therapy is increasing mitochondrial ATP production. So increasing energy production in the mitochondria.
Okay.
And so that's why it can work so well in different tissues. The red light, penetrates into the skin, increases or improves the mitochondrial health. And we know the mitochondria, really drive the health of the cell in general. So, and then we also know that red light, like I mentioned before, can be helpful for improving the way that stem cells work in the area. Like if we give stem cells and do red light afterwards, red light can promote healing. So a lot of times like dermatologists will use it after, laser procedures and things like that, because it improves the healing response and you heal faster because of the recruited stem cells to the area. But it has a lot of different ways, a lot of different uses. I love it for skin health. I love it for, there's great research for red light for increasing blood or hair growth. Increasing hair growth in men and women. Those red light caps that look kind of crazy. Those actually work. You have to use them several times a week. It's not it's not just once, but they actually do work in combination, especially with some of these other things.
Yeah, absolutely. I would second that because I had a hair crisis in my perimenopause where I literally lost probably 2/3 of my hair. I mean, it was awful. And I did go to someone to help and I had like a stronger laser but red light therapy cap, but then I use the cap and I still do. I use it a couple of times a week for 30 minutes and I think it makes a huge difference in at-home care, so for the health of your hair. So I would definitely agree with that. And I think red light therapy, using it all over. And tell me a little bit about how you're using it when it comes to sexual health.
So for sexual health, I love the intravaginal red light therapy devices. There's one from Joylux that's called VFit Plus that's been around for a long time that I've used. Yeah. But it's basically just red light therapy that just goes inside the vagina, and it kind of feels like a hot stone massage for your vagina. Like it's like kind of warm, and there's like a little bit of like heat, like a little bit of vibration, and it's like actually very pleasant. It's very nice. So sometimes I'll put in my VFit and the inside, and then I'll wrap like a red light around my face, and I'll turn on like some ocean sounds in my room, and I'll lock the door, and I'm like, don't come in, I'm busy.
No one come in.
I'll just lay there.
I'm regenerating, people.
I'm regenerating.
Oh my God, I love it. But I mean, it is such a great, natural, easy way to take here you are taking a little quiet time for yourself, right? Putting on some ocean sounds, and it's non-pharmacologic, and here you are, regenerating. And so let's talk about why would people want to do that for vaginal health? Because some people might be like, why am I sticking something red light into my vagina? What is the benefit of that?
So I will say there's some studies in humans, but they're not huge studies. So take it all with a grain of salt. But we know the benefits of red light therapy in other parts of the body. But the studies in humans that have been done show improved blood flow, better vaginal lubrication, some improvement in stress urinary incontinence also. So like bladder leakage, if you have kind of mild bladder leakage, it could potentially be beneficial because you could potentially improve the health of the tissue itself, which is supporting the urethra and keeping the urine from leaking out. Some women note improvements in sexual function, like pleasure and such. So, I will say it's, we don't have tons of robust research, but I find that with my patients, it's enjoyable. Like, it's not hard. It's not something that you dread doing.
Yeah.
The research for red light in general in the body is strong. And so I think that it's probably more beneficial than not.
Yeah. Okay. And so for like women that might be in perimenopause and menopause experiencing sort of those genitourinary symptoms of menopause, that covers like sort of a lot of symptoms that they might be, experiencing: dryness, painful sex, weakened or diminished orgasm. So in addition to red light therapy, are there other things that you would suggest for that?
I mean, low dose vaginal estrogen can't be beat, of course.
Yeah.
And that's something that I talk about a lot. But, any woman over the age of 45, 50, if you're not having regular periods anymore, I highly suggest getting on, or at least checking out, low dose vaginal estrogen. You just take it 3 days a week ish. It's super easy. It's super safe, even in breast cancer survivors. And we have tons of data for, everything from reducing recurring bladder infections to reducing bladder leaking to, of course, improving pain and reducing pain with sex and improving orgasms, all the things. We have tons of research on it.
Yeah. Okay. That's great. So let's talk a little bit about hormones now then. So vaginal estrogen, great. What are your thoughts on all the hormones? The estradiol, progesterone, testosterone, specifically for women that are in perimenopause or, probably don't even know that they're in perimenopause yet, but might be experiencing some symptoms.
Yeah.
What are your thoughts on that?
I mean, I'm pro hormones when you need them, I guess is my stance.
Yes.
I think in perimenopause is a tough time because your estrogen is kind of chaotic. It could be really high one day and really low the next. Like, that's part of perimenopause, right? That's all these crazy mood swings, roller coaster. Estrogen's going up and down like crazy. Usually progesterone is starting to trend down. So usually the first hormone we give in perimenopause is progesterone plus or minus testosterone. So usually one of those two are going to be your early kind of perimenopause hormones. And then as you get closer to menopause, as your hormones become as your periods become a little more erratic, estrogen is falling with progesterone, then often we'll add estrogen at that point. But I think that hormones are so important, not just for treating symptoms, but especially as you get into menopause, for preventing chronic diseases associated with estrogen loss in women.
Yeah, which is really the message that I think a lot of people are trying to, get out there loud and clear now about. It's not just about hot flashes.
Right.
That it is about our heart health, our brain health, our organ health, our skin health. I mean, it keeps going and going, right?
Yes, absolutely.
Yeah. So, and then what about like testosterone? I know you said testosterone, but I think it's sort of the last one that people think of when they think about needing a hormone replacement. Most of the time we're using it from compounded pharmacies because we can't get it from the pharmacy. It's
Right.
not FDA indicated yet.
Yep.
So when do you recommend a testosterone for women?
So testosterone is different than estrogen and progesterone. Estrogen and progesterone, when you go into menopause, they kind of fall off a cliff. Like, you go from having normal levels to having very low levels in the course of just a few years. Testosterone doesn't do that. It's been kind of trending down slowly starting at about age 25. So it's just a slow, gradual decline. It doesn't fall off a cliff, but it has been trending down starting at age 25.
Yeah.
So just like in men, testosterone goes down as we get older, and women have more testosterone in their bodies. We make more testosterone than we do estrogen. Just normal premenopausal women. So the idea that we wouldn't need testosterone replaced potentially is kind of crazy.
Yeah.
Now, I will say not all women need testosterone. Some women do continue to make higher doses of testosterone, and they don't require replacement. But certainly, testosterone can be important for everything from low libido and arousal problems, like sexual problems, as well as cognitive problems, like depression, mood changes, anxiety, difficulties with muscle building, difficulties with fat burning. Like testosterone, we have receptors all over our body. So you can replace it really at any age, depending on when you need it. But I see it especially in women who are, over 40 or so.
Yeah. Okay. So we talked about hormones, testosterone. I had a question and I lost it because that's what happens in menopause. First of all, I'm looking at you and I'm looking at how beautiful your skin is. And I'm like, I don't know whatever you're doing or putting on your face, but I need it.
Oh, well, thank you. Thank you.
Yeah, no. Because just thinking about when you think about regenerative and longevity medicine, it's like, it's really about, like you said, helping to keep us feeling healthier and stronger and more vibrant for as long as we can. So I guess my question is, if for someone who is listening to this and might be new to this sort of field of medicine and doesn't know where to start or even find a doctor in their area, what would be your advice for that? Like, is there a database? Is there a place to start? Because,
Yeah.
I think sometimes people are a little unsure about where to go.
I mean, I think it's a very difficult question, and I do get messages all the time, like, "Where do you know any
Yeah.
doctors in
Right.
Kansas?"
Right.
And and then usually the answer is I don't. It is
Right.
hard because there's not like a central place that doctors go for training. Like for
Yeah.
instance, for any of this stuff, there now certainly hormones. There's becoming a little bit more education out there, but even that, it's scattered. There's different types of trainings. There's different types of belief systems, and in how to prescribe hormones. Certainly
Exactly.
for
Yeah.
regenerative medicine, there's not a centralized like one track that you go to or certification program that everyone acknowledges. So it is difficult to say. I think the most important thing is, go online, like start Googling things like if you're looking for hormones, look up bioidentical hormones or body identical hormones near me and see, kind of what's nearby. If you have friends who are doing any of these things, talk to your friends, like ask
Yeah.
where they're going. I have a couple of clinics. I have one here in Utah and I have one in Texas and Florida. And we have a franchise, Humanot Health, which we are franchising longevity medicine for men and women, which will be branching out. So eventually we'll hopefully be everywhere. But
Yeah.
the main thing is just as best you can do research, but there's really not like a central secret database that has
Yeah.
all the information in it.
Right. Yeah, that makes sense, especially if it's not like a board certification, then it's, it
Yeah,
is. I
exactly.
get it. Okay, I remembered my question.
Oh, good.
I want to hear a little bit more about Hotbox and sort of what this is that you've created. So tell us a little bit about that.
So Hotbox, a few years ago, I was always writing down all the lists of supplements that I wanted my females to take, my women patients to take.
Yes.
And it was like 15 or 20 things, and it was like too much, like all these pill bottles, all these things. But it was similar ingredients for most women because it was things that they couldn't get enough of in food, no matter how healthy their diet was. But things that had been shown to be beneficial either for healthy aging or even potentially, slowing down aging. And so I created Hotbox. It's basically twice a day, like little packs. They look like this, little pill packs
Oh,
that
cool.
you just take
Okay.
twice a day. It's got 19 ingredients, just 5 packs. And it basically just to make it really easy for women to age in a better way, have more energy. It's good for skin and hair and as well as energy and metabolism. And that's it. So it's an educational platform. We're at hotbox.life. And then we also have the supplement packs.
That's amazing. And HOP stands for Human Optimization
Project.
Project. Yeah. Okay,
Yes,
that's what I thought.
exactly.
I love that. I mean, that's really what we're trying to do, right? We are trying to optimize our bodies and our lives each and every day. So I absolutely love that. Okay, so then I feel like you also have a couple other entrepreneurial, besides your clinic, then you have Hotbox. And there's something else that you have going on, right?
I do. I have a couple of clinics. So one of them,
Right.
the newest one is Humanot Health, which is like astronaut but with humans, Humanot.
Yes.
And I am
Yes.
the co-founder and chief medical officer, and we have a clinic in Austin, Texas, as well as Palm Beach Garden, Florida, and another one coming in Dallas, Texas. That's been a big use of my time because I
Yeah.
do all the protocols for it, all the clinical protocols, and then do the training for all the different providers and and all the things. So that's a big project, and I spend a lot of time on Humanot. But it's really exciting because it has under that roof, we're doing all the things I talked about. We're doing hormones,
Okay.
we're doing peptides, we're doing pretty advanced diagnostic screening tests for future diseases. We're doing regenerative medicine, like the stem cell procedures. We have all of the kind of cool stuff that you could do, hyperbarics and the gym and all that. So it's kind of all
Yeah.
under one roof, which is really what we want. And our goal with Humanot is to make this affordable to more people. Instead of
Right.
the $40,000 a year membership that some of these clinics have, like make it
Yeah.
something that most people can afford if they want to. So that's our ultimate goal, and then make it nationwide eventually.
Yeah, that's great. Can you come to Philly?
Yeah, sure.
Make Philadelphia, put Philadelphia on the next. Yeah. No, that would be great. That sounds amazing. And I love the idea of, making it more affordable, making it more just sort of approachable,
Yeah.
really. Because I think sometimes people hear regenerative and longevity and they do think of like hyperbaric chambers and like maybe things that
Yeah.
seem a little woo woo
A little
or
sci-fi, a little.
yes, exactly.
Yeah.
So I think making it more approachable and stuff too is amazing. And also, you have a new book coming out, right?
I do. I just signed my book deal with Hachette Publishing, which is one of the big publishers, and it's a women's longevity book told through the lens of reproductive health. So how ovarian aging affects longevity and health in women, how hormone optimization affects us, how regenerative procedures, sexual health, like the relationship between sexual health and longevity in women, and just kind of how important these topics are for women and for how we age, even though they aren't talked about. So it'll be out. It'll be a little while until it's out, but I'm excited.
Well, I think that's really fantastic. Congratulations.
Thank you.
Because, let's talk about that a little bit because we didn't really know what menopause is. I mean, you've been in medicine. I've been involved in healthcare medicine. And yet I do feel like, it wasn't until my late 30s and early 40s when I was sort of had to do so much research and advocating for myself and finding different practitioners and failing with a lot of different practitioners and going to the next one and the next one, where I sort of learned so much more about my own health and my body and switching really my thought process and my perspective of, healthcare, these institutions know everything and the doctors know it all. And to wait a second, I'm actually in control of my body and what I put in my body and what I take and how I feel. And so someone telling me that, you're fine and you're normal or, anyway, that whole thing. But like, I feel like there has been a surgence in women just sort of understanding women's health. So from your perspective as a physician, and what do you think is maybe one of the most important things that women don't realize, or maybe not that we've been lied to, but we've been told, and that now we're coming to learn that maybe isn't true.
Yeah. One of the biggest things, and people don't like to hear this, but I'm going to say it anyway.
Yeah.
Menopause is actually very bad for your body.
Yeah.
And when your ovaries stop working, when you run out of eggs, which is of course when menopause happens, that's a really dangerous time for women. And it's not a good thing. Now, certainly you can make the best of it. Like you can have a good mindset, you can eat well, you can exercise, like you should do all those things. And we don't hate the women going through menopause. We love them. But menopause itself is really bad for us. We see this huge increase in cardiovascular disease when you lose estrogen. All of a sudden your blood vessels, which were protected, they start to fill with plaque. We see brain changes, and all of a sudden dementia becomes more possible. We see bone loss at a rapid rate when we lose estrogen. So the loss of estrogen primarily, but also progesterone and testosterone at menopause, it is a very bad thing. And we have to, now not all women can take estrogen, not all women want to take estrogen, but even if you don't choose to take hormones, you should understand what menopause is doing to your body so that you can try to counteract those negative changes as best as possible with whatever method you choose to use.
Yeah, absolutely. And that is something that, again, we were never really told, nor did we really think about it until you sort of are in it. Or, you're not really thinking about, and I think that, a lot of women are experiencing symptoms that are systemic and that are, have to do with different organ systems in our body, but don't realize that it's because our hormones are changing so significantly. And, that's the thing. That's the time to intervene, not so much 10 years after that when, when the symptoms start to subside, and you're feeling a little bit better, but really, some of the damage to our bodies have been done because we
Yeah.
just were never told.
And there is a window. I mean, certainly you can take hormones even later, and there are some reasons to do that. I don't think it's just the first 10 years, but we do
Right.
know that earlier is better. It is better to start hormones within 5 or 6 years of menopause onset than it is 10 or 15 years, because you can prevent certain things. Like you can prevent and reduce the risk of heart disease if you start estrogen early. The studies where you start estrogen late, we do not see further prevention of heart disease. So there are reasons to start early. And I feel like, in some ways, women who have symptoms, have pretty severe symptoms in perimenopause and menopause, in some ways they're the lucky ones, because
Yeah.
they go to the doctors, they ask for help, they press until they get it, and then they get those hormones. It's the women who don't have symptoms or who decide to tough it out and suffer through, and I'm super tough and I can do this. Those are
Yeah.
the women that essentially don't get the hormones, and then they get 10 or 15 years down the line and they have osteoporosis and they break a hip and they don't understand what happened. So I feel like all women deserve a conversation with their doctors about positives and negatives of hormone replacement. And not everyone's going to choose to do it, but I feel like every single woman deserves that discussion.
Yeah. No, I completely agree. Are there certain similarities or something that is like glaring that you see maybe with the women that come to you specifically, that, like you said, most of them are healthy and they're probably doing all the right things and they're trying a lot of different things to feel good. Is there something that maybe stands out to you that is a similarity that a lot of women are sort of sharing or experiencing at this time?
One of the things I hear a lot is that women don't recognize themselves anymore
Yeah.
in the mirror or in their clothes,
Yeah.
and or that they feel like they're going crazy.
Yeah. Yeah. Wow. That is so true. What do you say for the what's the solution for that? No,
That
seriously. Like, I mean, honestly, like I hear that a lot too from my clients, from friends. So what is this like how can you help them from the regenerative and longevity standpoint, especially with I don't feel like myself. Like I feel like
yeah.
I'm going crazy because that's really the tough one too.
I mean, part of it's education. Part of it is understanding. Like if I show them a chart of what their estrogen is doing right now, and the
Yeah.
fact that it's supposed to be kind of gently going up and down each month, but now it's going like crazy. It's jumping around like crazy. Like
Yeah.
that's part of why you feel like you're going crazy. Like your estrogen is kind of going crazy, and you don't have the balance of progesterone like you used to. So part of it is just education. And then part of it is just really this kind of holistic approach of combination of very specific personalized lifestyle changes that can happen that we can kind of take slowly but get in the right direction. Maybe hormone replacement, maybe it's other therapies, depending on what their concerns are. Maybe it's supplements, but it's really a combination approach using the best tools that are available in both allopathic medicine. Maybe it's medications, as well as integrative medicine, as well as kind of lifestyle medicine.
Yeah. Yeah, I love that. I think education and explaining why you're feeling that way is probably so important because I think a lot of women who quote unquote feel like they're going crazy think that it's them,
Right.
that it's in their head. They should just suck it up, keep on going. What's wrong with me? Why am I thinking these things? Why do I feel this way? Why am I having, new onset anxiety, whatever it may
Yeah.
be? But
Yeah.
understanding that it's really is because of hormones and things that are going on in your body that are kind of leading you down that path,
Yeah. And
it's
and
very helpful.
women will see 5 or 6 doctors oftentimes before they get appropriately diagnosed with perimenopause. They'll see their neurologist, and they'll see someone else for their knee pain, and they'll see someone else for their anxiety, and they'll see, they're seeing palpitations, they'll see a cardiologist. So they're seeing all these different doctors, and each doctor, many of them are not up to date on what perimenopause is. And so each doctor is just giving them, kind of a Band-Aid, giving you some anti-inflammatories, giving you a medication for
Right.
your
Right.
heart palpitations, giving you an SSRI for your depression. And so all of a sudden now you've got this whole like pharmacy of medications
Yeah.
by your nightstand for all these things that really are just because your hormones are a little bit wonky and potentially could have been treated with just, some bioidentical hormones.
Yeah, exactly. So, do you have patients that travel, from pretty far to see you, especially like maybe to get like the whole body stem cell treatment and that sort of thing? Because it sounds like, it is something you can kind of come in, you do, right? And then you're seeing the benefit or you're seeing some changes months later, but it's not something you have to keep coming back for. So, back to our point about not having people maybe locally or where you're at, but so do you have a lot of patients that come from pretty far distances to get
Yeah.
these type of treatments?
We do. For the full body stem cell makeover procedures, we have people, from all over the world. We've treated people from Australia and Dubai and all over Europe and
Yeah.
and certainly here in the US as well. But you come in town
Right.
for just a few days, 2 or 3 days usually, and do the procedure, have a day to just kind of relax afterwards, and then you can fly home. But it's a big procedure, and it's not an inexpensive procedure, but a lot of people really like it and will come from pretty far away.
Yeah. Yeah, that's great. Okay, so tell my listeners where they can find out more about you.
So I'm very active on social media, Dr. Amy B. Killen on Instagram and all the things. And then my website is dramykillen.com. And on my website, I have links to all my other things, to my projects, my companies, my clinics, et cetera. So I've got a lot of information on there.
Oh, that's wonderful. Well, we'll be sure to link all of your websites and your social media, which if you don't already follow Amy B. Killen, you guys absolutely should, because she has so much information on her social, and I think you do a really phenomenal job with that. So I want to thank you so much for being on the podcast today. I feel like I learned so much, and it's encouraging to hear that there's so many new and really not so new therapies, but are just being used in different ways for longevity and our vitality and wellness, and really just helping us to heal at the cellular level to become the best version of ourselves. So thank you so much for being here today to share all of that information with us.
Thank you so much. It was really fun seeing you.
Yeah, you too. And guys, thank you so much for listening to the Suburban Warrior podcast. Be sure to click that follow button so you don't miss any amazing episodes. And I'll be back next week with another Suburban Warrior here to share her story with us. Until then, have an awesome week, guys.